No response! Keep breathing! Vitals dropping. Faster! Heart rate critical. Prep the crash cart.
Boston, Massachusetts, September 9th, 1988. At exactly 9:30 that morning, Patty Owen felt the pain begin. At first, she tried to ignore it. Throughout the final weeks of pregnancy, she had experienced plenty of discomfort. Little cramps, pressure, the baby moving inside her. But this was different. This pain came in waves, slowly building, tightening across her lower back, then fading away again. 20 minutes later, it returned. Then again. Patty placed her hand gently over her stomach and whispered softly, "This is it." Her baby boy was finally coming. For a brief moment, happiness pushed away her fear. Soon she and her husband Clark would finally meet their son, Mark. But then reality hit her. Clark wasn't there. He had left the day before for an important business trip. He hated leaving Patty so close to her due date, but his company gave him no choice. Now, as another contraction gripped her body, Patty searched nervously through papers scattered across the kitchen desk for the hotel number he had left behind. Her hands trembled. She dialed quickly. The hotel operator answered politely and transferred the call to Clark's room. The phone rang once, twice, 5 times. No answer.
It feels so real
Patty
now.
closed her eyes, fighting back tears.
I can't
She
wait
needed to hear
meet
his
them.
voice.
Patty left a short message for her husband. "Please call Boston Memorial Hospital immediately."
I'm
The
worried.
moment she hung up the phone,
Are you sure no one
another
followed
contraction tightened painfully through her
You?
body.
I can't talk long.
But the physical pain wasn't the worst part. It was the fear. Ever since becoming pregnant, Patty had carried a strange
I
feeling
know. I
deep
can
inside her.
hardly wait either.
A
It won't
dark
be long
feeling
now.
she could never
I'll call you
explain.
back later. Okay.
A sense that something terrible was waiting.
Nothing to worry about. You both look
Trying
perfectly
desperately to
healthy.
calm herself, she called her
Oh, doctor,
obstetrician,
you always
Dr.
know
Ralph
how to lighten the
Samarian.
mood.
Unlike Patty, the doctor sounded cheerful and relaxed. He assured her everything sounded perfectly normal. He even joked about husbands disappearing at the worst possible moment.
St. Agatha.
Patty forced herself to laugh. Then she admitted quietly, "I'm scared." Dr. Samarian immediately softened his tone. He promised her she'd be
I
fine.
really like Ren.
He also agreed to
yeah.
give her the
What about
epidural
Hollywood
anesthesia she
in
wanted during labor.
That's perfect.
That helped.
I love it.
For a moment. Then Patty looked outside. The bright September sunlight had disappeared. Dark storm clouds rolled across the sky. Wind bent the trees violently outside the house. Thunder rumbled in the distance. A cold shiver ran through Patty's body. She didn't believe in signs or omens. But somehow, this felt wrong. Very wrong. Inside Boston Memorial Hospital, Dr. Jeffrey Rhodes was barely making it through the day. For more than 6 straight hours, he had been inside operating rooms, moving from one case to another without rest. The surgical mask hanging around his neck felt heavy. His entire body ached with exhaustion. But fatigue wasn't his only problem. Since early that morning, Jeffrey had felt sick. At first, he ignored it. Doctors were trained to
Yes,
ignore
her vitals are
discomfort.
stable.
A little
Thank
dizziness,
you.
probably too
All
much
right,
coffee,
Everything looks good. The
Nausea,
results came back perfect.
maybe something bad from the
Vitals are
cafeteria
stable,
lunch,
but monitor the blood pressure
stomach
closely
cramps,
during the procedure.
stress.
Agreed. Let's prep for the incision.
But now, standing alone in the crowded locker room, Jeffrey finally looked into the mirror and admitted the truth to himself. He looked terrible. His skin was pale, dark circles surrounded his eyes. Even his posture seemed weaker than normal. He touched his forehead, fever. Most likely the flu spreading through the hospital. Jeffrey leaned against the sink for a moment, trying to steady himself, while nurses and doctors laughed and talked around him, unaware of how awful he felt. Then his pager vibrated. Another patient assignment. Patty Owen. Epidural anesthesia for labor.
Jeffrey knew he couldn't continue much longer feeling the way he did. Before heading to the maternity ward, he quietly entered an empty anesthesia alcove beside the operating rooms and pulled the curtain closed behind him. The room was silent. Quickly, he gathered IV supplies from the anesthesia cart, tubing, a needle, and a bag of intravenous fluid. This wasn't unusual among exhausted doctors. During residency, physicians often pushed themselves far beyond their limits. When dehydration or illness became unbearable, they sometimes gave themselves IV fluids to stay functional. Jeffrey had done it before, but not in years. Carefully, he tied a tourniquet around his arm and inserted the needle into his own vein. Cold fluid began flowing into his bloodstream. Within minutes, the dizziness eased. The headache faded slightly. For the first time all day, he almost felt normal again. Then suddenly, the curtain opened. A nurse named Regina Vincent stood frozen in the doorway.
Congratulations.
Her eyes moved from Jeffrey's face to the IV needle in his arm. An awkward silence filled the room. Jeffrey tried to smile.
There is nothing to be concerned
Want
about.
some? He joked
You
weakly,
and the baby
holding
are
up the
doing
bottle.
fine.
Regina didn't laugh. She looked disturbed. Without saying another word, she stepped backward and
You're doing
disappeared into the hallway.
We'll start very slowly. Just let me know if you feel
Jeffrey
any
sighed
discomfort.
and quickly removed the IV. For a moment,
Everything looks
he
good.
wondered how bad the
We're right here
situation
with
had
you.
looked.
So,
Try to take
A
it easy.
sick doctor secretly treating himself inside an empty room. Still, he convinced himself it wasn't important. He threw away the equipment, straightened his scrubs, and headed toward Patty Owen's labor room, completely unaware that someone had just witnessed the beginning of a disaster. When Jeffrey entered labor room 15, Patty Owen looked at him with desperate relief.
I can still feel that in my
Finally,
leg.
someone
Okay,
was
that's
there to
normal.
help her.
let me explain what's happening.
She looked so young lying in the hospital bed. Her blonde hair
feel
clung
that
to
in
her
my legs.
forehead with sweat,
It's normal
and
to feel
every
some
few
pressure.
minutes, another
almost
contraction
done.
tightened painfully through her body. The moment Jeffrey introduced himself, Patty reached for his hand. "I'm scared," she admitted softly. "I'm terrible with pain." Jeffrey smiled calmly. "You're going to be fine," he assured her. His voice was confident, warm, professional. Exactly what Patty needed to hear. Slowly, she relaxed enough to speak openly. She explained how upset she was that her husband Clark wasn't there. He had left on a business trip, believing the baby wouldn't arrive for another week. Now she faced labor completely alone. Jeffrey listened patiently. He explained every detail of the epidural procedure, carefully answering her questions one by one. Patty trusted him immediately.
Monica, I'm looking at
And
the
Jeffrey
board now.
truly
Yes, I see
wanted
the
to help
conflict.
her.
I'm crossing this out. Move Dr.
But while
Ramirez
he
to
comforted
OR4
his
immediately.
frightened patient,
Confirm that you have updated the system.
his own
That's
body
it. Just keep breathing
continued
through the
weakening.
contraction.
Pain twisted through his stomach again.
You are doing so well.
Sweat formed beneath his surgical mask.
We're ready to start the
For
epidural
one
now.
dangerous
and you're doing
moment,
great.
Jeffrey
Oh,
felt
thank you
dizzy
so
enough
much.
to lose
I'm
balance.
so relieved.
He quietly steadied himself against
All
the
right,
bed rail
just
before
cleaning the
Patty
area
noticed.
now. It's a bit cold, but
Then he
it'll be
smiled
quick.
again. Professional. Controlled. Confident. Because no matter how terrible he felt,
Take a deep
his
breath.
patient
for me.
could never know.
You're doing very well.
Somewhere
Almost
beyond
done.
the hospital windows, thunder rolled through the darkening
Okay,
sky.
deep breaths now.
Hours
You're
later,
doing very well.
Patty's contractions became stronger and closer together. It
It was finally time for the epidural. Jeffrey prepared the equipment carefully while nurses adjusted the monitors surrounding the bed.
Slight sensation in my leg.
Everything appeared normal. Patty curled onto her side while Jeffrey sterilized her lower back with practiced precision.
That's normal. The catheter
Despite his exhaustion, his hands remained steady.
We're all finished here.
First came the small injection of local anesthetic,
Thank you. That's wonderful.
then the larger epidural needle. Jeffrey advanced it slowly and carefully, concentrating on every movement. He reached the epidural space successfully. Perfect placement. Then came the test dose. Jeffrey watched the monitors closely. Heart rate stable. Blood pressure normal. No signs of danger.
Doctor,
Satisfied,
wake up.
he threaded the tiny catheter into place
We have a
and
problem with
administered
room
the anesthetic medication. Within minutes, Patty's pain began disappearing. Relief spread across her face. "It's working," she whispered with amazement. Jeffrey smiled reassuringly. Everything had gone exactly as planned. After
That's
checking
it.
her vital
Take
signs
breaths.
again
You are
and
doing
completing
so
his
well.
notes,
Keep going.
Jeffrey quietly stepped out of the room. He instructed the nurses to call him immediately if anything changed. Then, exhausted beyond reason,
You are
he entered an
doing
empty
wonderfully.
labor room nearby.
Just take a deep breath. with me,
Rain
you're
tapped
almost there.
softly against the hospital
That's
windows.
It. Nice and easy.
Jeffrey sat down only intending to rest his eyes for a moment. But within seconds, he fell deeply asleep. Outside, the storm continued growing stronger. And while Jeffrey slept, events were already moving toward catastrophe.
Jeffrey woke suddenly to someone shaking his shoulder. A nurse stood over him with panic in her eyes. "We've got a problem." Disoriented, Jeffrey checked his watch. He had been asleep for more than 90 minutes. Immediately, he stood up. The baby's heart rate had begun slowing dangerously after every contraction. Labor was no longer progressing normally. Dr. Sumerian had decided on an emergency cesarean section. Jeffrey forced himself awake and headed toward the bathroom sink. But when he looked into the mirror,
Pushing the
froze.
medication now. Let me know if
his
you feel
pupils
anything
had
sharp.
become
You're
tiny
doing great, honey.
pinpoints,
Just relax.
abnormally small. For one brief second, fear crossed his face. Something about his condition no longer felt normal.
What's
Still,
the status?
there was no time to think about himself. Patty
Blood
needed
pressure is
surgery
dropping, doctor.
immediately.
We have tachycardia.
Jeffrey splashed cold water across his face and hurried
Everything
toward the
looks good
operating
down
room.
here. You're doing
Outside,
great.
the storm hammered
thank
rain
you.
against the hospital windows. Inside the operating room, nurses prepared surgical instruments while Patty lay frightened beneath bright surgical lights. Jeffrey moved quickly, attaching monitors and preparing medications. Despite the growing uneasiness inside him, he remained calm and professional. Patty looked at him nervously. "I'll be okay, right?" she whispered. Jeffrey nodded confidently. "You'll be fine." But deep inside, he was no longer completely sure.
inside the operating room, Jeffrey administered another dose of anesthetic through Patty's epidural catheter. At first, everything appeared normal. Then, suddenly, the heart monitor changed. Patty's pulse began
We've got you,
climbing
Patty.
rapidly.
Just try to relax.
Jeffrey
and breathe.
frowned.
We're right here.
That wasn't supposed to
Everything is going
happen.
be fine.
Then,
Breathe
the rhythm
slowly
became
now.
irregular,
You're safe with us.
dangerously
I can't.
irregular.
Just try to relax.
Patty
now.
turned
We've got
weakly
you.
toward him. "I don't feel right." Seconds later, she screamed. Sharp pain exploded beneath her ribs. Her body twisted violently against the operating table. Saliva poured from her mouth. Tears streamed down her cheeks. Jeffrey reacted immediately. He suctioned her airway and injected emergency medications while nurses rushed around the room in confusion. But the symptoms only became worse. Patty's muscles began jerking uncontrollably. Then, the seizure started. Dr. Sumerian burst into the room. "What's happening?" Jeffrey didn't know. Nothing made
We're
sense.
losing her. Push the
Then,
atropine and ephedrine
Suddenly,
now.
Patty's heart stopped.
Vitals check.
The
Stat.
monitors erupted into shrill alarms. Chaos exploded throughout the operating
Pushing 1
room.
milligram of
Doctors
atropine,
shouted
10 of it.
orders. Nurses prepared emergency drugs and defibrillators. Meanwhile, the baby's heartbeat slowed dangerously inside Patty's body. There was almost no time left. Jeffrey began CPR while Sumerian prepared for emergency
Stay
surgery.
with me, Patty.
Everyone inside the room understood one terrifying truth. If they failed now, both mother and child would die.
Dr. Sumerian immediately began the emergency cesarean section, while Jeffrey fought desperately to restart Patty's heart. Electric shocks slammed into her chest.
5 milligrams of
Medication after medication entered her bloodstream.
Doctor, pushing now.
Still, no heartbeat.
Give me 1 amp of
The monitor
now.
displayed only chaotic
Continuing.
electrical patterns
Still
and
no
terrifying silence.
Start
Then
compressions.
finally,
We're losing her.
the baby was
Charging
delivered.
now. Get the crash cart ready.
Little Mark emerged blue, silent, and barely
Move
alive.
quickly.
Pediatricians rushed him across the room and began
Hand me the
emergency
scalpel.
resuscitation.
Hand me the scalpel.
But even they quickly realized something was
Continue bagging.
terribly wrong.
Get me the Epi 1
The
to
baby's
10,000
movements
stat.
were abnormal.
What's
One
the
arm
saturation?
barely moved. One leg remained limp.
We're losing them.
Oxygen deprivation had already damaged his brain. Meanwhile, Jeffrey refused to stop fighting for Patty. A cardiac surgeon named Ted Overstreet arrived and suggested one final desperate attempt. Open her chest.
I understand
Work
the risk,
directly
nurse.
on the
I
heart
must
itself.
stabilize immediately.
Jeffrey agreed immediately. Within minutes, surgeons cut open Patty's chest cavity, while the room fell into tense silence.
1 of Epi now. Still no
Ted reached
pulse.
inside and began massaging her heart with his gloved hands. He injected medications directly into the heart muscle.
Someone prep the Epi.
Still nothing. Minute after
Vitals are
minute
crashing,
passed.
doctor.
No heartbeat. No response. Finally, Ted looked up slowly. It's over. The words hit Jeffrey like a knife. For a long moment, nobody moved. Nobody
Procedure
spoke.
was successful, Ted.
Only the
Stay
storm
with it.
outside continued
We'll need to
raging
observe
against the
closely
hospital
for the next
windows.
24 hours.
The operating room slowly emptied.
The board will
Patty
never
Owen
approve this
was
restructure.
dead.
I don't need their
Her newborn
approval.
son had suffered devastating brain damage,
No change.
and Dr. Jeffrey Rhodes stood frozen beside the anesthesia machine, emotionally numb. Around him, the floor was covered with syringes, wrappers,
Now.
blood-stained towels,
There.
and discarded
Stable
medical
signs
equipment. Jeffrey stared blankly at the chaos surrounding him. Then, one thought entered his mind. The Marcaine. The anesthetic drug. If something had gone wrong, the answer might be inside that vial.
5 minutes, maybe less.
Jeffrey searched desperately across the anesthesia cart,
Another unit of plasma.
but it was gone.
We're losing him. Blood
He
pressure
turned
is
toward the
crashing.
circulating nurse. "Where's the Marcaine vial?" The nurse looked at him coldly. "If you don't know," she snapped angrily, "I certainly don't." Jeffrey blinked in confusion.
Sheila,
Her anger felt personal,
what did you do with the fentanyl?
and suddenly
I didn't touch
he
it,
remembered
Jeffrey,
the
I swear.
strange looks nurses had given him earlier that evening. The hidden IV, the exhaustion, his tiny pupils. They had noticed. And now, suspicion was beginning to spread. Not suspicion toward the drug, toward him. Jeffrey looked back at Patty's lifeless body lying beneath the surgical lights.